Stem cell tourism is developing as quickly as the field of stem cell research. This project will explore the ethics and dilemmas of stem cell tourism and the politics of hope. This is a public service announcement. Traveling to receive experimental treatments that are based on stem cell research are creating a false sense of promise. Desperate people are vulnerable to promises made by companies marketing promises of unproven treatments. Now, a message from our mascot, Stu the Stem Cell.
Hi, I'm Stem Cell Stu, and I just want to differentiate between legitimate stem cell research and companies that are offering my services unscrupulously.
Stem cell tourism describes when a patient decides to go to a clinic to receive treatment for a disease or injury with unproven techniques involving stem cells.
Patients travel for various medical reasons. Most travel specifically for stem cell therapies targeting people with cancer, heart disease, multiple sclerosis, or injuries not treatable by traditional therapies. None of these treatments are valid or approved by the FDA. Still, thousands of desperate people try, even though they may lose health insurance coverage and certainly a lot of money.
Hi, my name is Bobby. I'm 4 years old, and I have a terminal heart injury.
My name is Sarah Ross. I am 21 years old, and I suffer from acute myeloid leukemia.
With a quick Google search, my mom found the Stem Cell Institute in Panama. We spoke to them, and they offered us hope.
My parents researched online for alternative treatments that could possibly save my life, and they found StemGenix.
My parents chose this therapy because there was no other way to treat my injury. They spoke to my doctor, but he said it was going to be risky. But we went anyways, since I didn't have much time left.
I chose this treatment because AML is a very hard disease to treat. With chemotherapy, it will take way too long and be very painful since it needs such high-intensity radiation.
Many unproven treatments are being promised around the globe. A company in Australia promises bone marrow transplants for multiple sclerosis, stem cell therapies for diabetes, and stem cell treatments for skin cancer. A company in Panama offers stem cell treatments for autism, cerebral palsy, heart failure, osteoarthritis, rheumatoid arthritis, spinal cord injuries, and autoimmune diseases. Even in the United States, companies offer treatments for Alzheimer's, chronic obstructive pulmonary disease, and Parkinson's.
If it sounds too good to be true, it probably is. Many of these unproven treatments have not been approved by the FDA. Treatment is often offered by for-profit organizations and companies. In addition to the challenges that may arise, stem cell treatments require extensive follow-up that may not be available or provided by the agency offering the treatment. There are many countries that allow stem cell treatments, including the United States. Treatment clinics that are not working as clinical researchers are having a negative impact on legitimate scientific and medical communities around the world. The International Society of Stem Cell Research is a legitimate source for information about stem cell tourism and its hazards.
Treatment centers are located around the world. Typically, they are in countries with laws that do not regulate experimentation with stem cells, and in nations with unproven treatments unavailable in the United States. Buyer beware is an understatement. When considering going to a clinic that offers treatment with stem cells, ISSCR offers patient handbooks to help you evaluate the treatment you're considering. According to the Center for Disease Control and Prevention, or the CDC, the most common destinations for stem cell tourism are Thailand, Mexico, Singapore, India, Malaysia, Cuba, Brazil, Argentina, and Costa Rica. The American Medical Association provides guidelines for medical tourism, which include basic and ethical guidelines. Some guidelines include medical care outside the U.S. must be voluntary, and patients should only be referred for medical care to institutions that have been accredited or recognized internationally. These are among others that outline patients' rights to know and the right of a patient to informed consent. Although there are no indications that the United States government limits or restricts travel for medical tourism, the CDC provides guidelines and considerations for patients interested in overseas procedures. StemGenix claims to have 100% customer satisfaction. Their website does not include testimonies or the number of patients they have treated. but they do show misleading graphs for customer satisfaction. Various sources report different price ranges. The Huffington Post reports $10,000 to $20,000 and up per treatment. CNN reports over $25,000, while the California Stem Cell Report suggests $512,000 for one stem cell treatment. Exact prices are not disclosed, but the cost of travel, treatment, and other medical expenses must be considered. One treatment facility claims U.S. health insurance does not cover the cost of this procedure. However, many European and government-funded health insurance provides coverage for stem cell procedures. According to the CDC, medical tourism is a term commonly used to describe people traveling outside their home country for medical treatment. Most medical tourists rely on private companies or medical concierge services to identify foreign healthcare facilities, and they pay for the care out of pocket.
At the time I went through the stem cell transplant, I was in desperate need of feeling better. I did not realize how long the process was going to take and how expensive it was really going to be. I did not want to go through chemotherapy, but at the end I had to go through it anyways and had $15,000 less in my bank account.
Our son's last days were spent in pain on a hospital bed in Panama. The doctors fed us with so much hope, but in the end, nothing could save our dying son. I would have rather kept him at home where he could have spent his last days with friends and family.